Moderator, and I'll be here each Wednesday at noon for this update. This forum is being brought to you live by PAC TV on Comcast Channel 15 and Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants include Dr. Barry Potvin, who is the chair of the Plymouth Board of Health, Heather Cozby, she is a Plymouth CPA, and Mathew Muratore, Plymouth State Representative. And we're going to begin, as we do each week, with our health segment as we welcome back Dr. Barry Potvin. Welcome, Barry.
Yes, thank you, Steve. I've been spending the last 2 or 3 hours just accumulating the latest data I could get my hands on from the CDC and the Department of Public Health. So I'm going to go through it as usual, and then I'm going to make some other comments, I think. So get this set up. So is that visible to everyone? Okay. So you can see from this chart that I show every time, if you look way over on the right, that in fact our numbers, which are average daily cases per 100,000 over 14 days, has continued to go up, unfortunately. It hasn't really leveled off that much. These are the data as of, I guess, yesterday at 5 minutes of 6. I don't really need to go through the US and the state cases that much. Again, just keep in mind that these are both confirmed and suspected cases. And so the numbers that you may see from that might be somewhat lower. The ones that we have to pay attention to, of course, are the ones down at the bottom, which is for the town of Plymouth. So these numbers are growing faster than we're used to. It's up to 5,933 cases now. And yesterday we had 40 new cases, which is the highest number that we have seen since around the 6th of April. So it's getting very concerning. We've also had 2 more deaths than we had. So we were at 151 for a long, long time. And things were looking very hopeful. And then 2 more deaths occurred just recently. One of them I just wanted to point out was a man in his 70s. And he had only 1 shot of the Pfizer vaccine. So you could call it a breakthrough, but unfortunately he never got the second shot, which would have given him a lot more protection. And I think, everybody, especially those in the older age groups, should definitely be aware of the fact that you're much better off and you're much more fully protected if you have both shots of the Pfizer or the Moderna vaccine. And not everyone has. So there's something like about 1,400 individuals in those older age groups that only got 1 shot and never got the second. And it does put you at more risk for hospitalization, serious illness, and unfortunately, even potentially death. So this is also looks a little more promising. This is a plot of the number of active COVID cases that we see in Plymouth. And you could see it was going up quite a lot during August, and then starting around the 1st of September, it pretty much leveled off. So these are things that come out on a daily basis that's put out by the public health nurse. This is Plymouth County's forecasting that's done by the CDC. And again, something hopeful. You notice that, yes, it was going up pretty consistently all the way through early September, mid-September. But the forecast from the CDC is now that it's probably going to level off, but not drop here in Plymouth County. This is the risk criteria, which you'll see again in a minute. So for Plymouth County, when you look at these numbers, which are positive cases over 7 days, and it's per 100,000 population, Plymouth County came in at 135.84, which puts them into the high risk category. And the town of Plymouth came in higher still than our county, which was 156.2. What that means is that if you look at this map of the state of Massachusetts, which is divided by counties, at this point, as of September 11th, all 13 Massachusetts counties are considered high risk for COVID transmission by the CDC. And again, much of this, or almost all of this, is being caused by the Delta variant. In terms of what's going on with the US, and if you start to look at the number of fully vaccinated people, in the US, it's now 53.8%. In the state, it's 66.8%. And Plymouth is below the state average at about 62%. Way down at the bottom, which was put together after what happened in Provincetown, you can see that what they did as a guideline was to make an advisory for wearing face masks if this number, which is test positivity rate, was above 1% but below 3%, and they made it a mandate if it went 3% and above. Town of Plymouth is now 4.00%, and Plymouth County is 3.71. So we're up in the region of the test positivity rate. That probably indicates that if this was going on like it did in Provincetown, we'd have to go to a mandate for face mask wearing. This is admissions for people going into the hospital with confirmed COVID-19 cases, and it's statewide. But basically, you can see that it did show another peak of hospitalizations, but that rate of increase seems to have pretty much leveled off most recently. This is, again, more indication of what's going on with hospitalizations, and this is just for Plymouth County, not for the state. So new admissions in the last 7 days was 23, and so that's gone down by 14.82%. Numbers of beds used, 3.02, that's the percent beds used in the last 7 days, went down a little. And number of ICU beds, 18.3, also went down a little. So those are promising numbers indicating that we're probably not at the situation which a lot of other states are, where they have much lower vaccination rates. Hospitals are being crushed and they're having to send patients off to other states. The staff is overwhelmed, and some people are actually having difficulty getting ICU space for other diseases like heart disease, chronic heart disease. And in some cases, that's been a big problem in other states. This is our Plymouth vaccination data. The numbers you see underlined once again, which are for 1 or more doses of the vaccine, still remains lower than the state average for those 12 to 15 years of age. And they're down by about 14% below the state average. The 20 to 29-year-old group is about 8% below the state average, and the 30 to 49-year age group is about 15% below the state average. That being said, our overall numbers are not too horrible. Again, notice down here, when you look at the 65 to 74 and the 75 plus age group, these are the numbers that are fully vaccinated, and that's the total population. And so you notice right away that there is a small percentage of them that in fact only got the first dose of the vaccines, not both. This is for Massachusetts, the corresponding percentages for those who are in the blue case, individuals with at least 1 dose of the vaccine. And you can see that these numbers are higher than what you just saw for Plymouth for this group, for the 20 to 29-year-old group, and for the 30 to 39-year-old group. This is recent data that also just came out, and it shows you that for the most part, changes from the previous week for new confirmed hospital admissions has gone down 4%. The community transmission level is still high, but a lot of these other changes have not really changed all that much in the past week. This shows you the cumulative percentage of eligible individuals who are above 12 years of age who are fully vaccinated by county of resident address. Remember, that excludes those who are under the age of 12 that can't get the vaccine yet. And so Plymouth, it's 69%. But unfortunately, compared to the other counties in the state, or many of them at least, we're below what we hope to be. This is the percentage of everyone, including those who are under the age of 12 that can't get the vaccine as yet. And you can see it's fully vaccinated people in that group, according to this, is about 60% for Plymouth. And again, that's lower than all except about 3 of the counties in Massachusetts. So breakthrough cases, again, this is reported every week now, and you can see that percentage of fully vaccinated individuals in terms of the cases that are popping up has gone up, but it's gone up by 0.61%. The hospitalizations have gone up by just 0.02. That's the same as the previous one for the previous report. And the deaths have gone up by 0.004%. So things are going up. You can see the comparison of the numbers here. But for the most part, it's not really happening to fully vaccinated individuals to any great extent. These are all well below 1% or even 0.1% or even 0.001%. So it's not a matter of fully vaccinated individuals this is happening to, it's the ones who are not yet vaccinated that are bearing the brunt of all these increases. So that's what I'm going to do at the moment. I think before we started, there was made mention of a question that came in about what the Board of Health and the Department of Public Health can do in the light of increasing numbers and still unsatisfactory vaccination percentages here in the town of Plymouth. And all I can tell you is that every meeting of the Board of Health, we always look at all these numbers and we always consider whether or not the mask advisory that we have in place should remain as an advisory or should be changed to a mandate. We did that last Wednesday, and there were 2 votes to make it a mandate, and there were 3 votes to leave it as an advisory, so it stayed as an advisory. But we'll look at it again a week from today at our next Board of Health meeting. That's all I can do for the moment. I'll answer questions later on. Thanks, Steve.
Thank you, Dr. Barry Potvin. He is Professor Emeritus, Yeshiva University Department of Biology, and he'll be here to answer your questions. Send them to PlymouthInfo@pactv.org. And now we welcome back Heather Cozby. She is a CPA in Plymouth. Welcome, Heather.
Thank you. I'm happy to see you. Not excited that we're still doing this, but I have a lot of information. I think that will help. So my goal today is to kind of give a state of the IRS as far as the biggest issues I've been hearing is dealing with the IRS, multitude of notices coming out, no access. So I wanted to kind of go over in a big picture, and I actually am going to attempt to do it where Mr. Potvin did, Dr. Potvin, and split my screen. So we'll see how that goes. So in general, the IRS is basically broken. And when I say that, they are sending out notices left and right, but they're only answering 7% of their phone calls. So they have announced on the 10th that they've just now started opening mail in April. They're proud of themselves for completing opening March's mail. So there's a lot of taxpayers that have sent correspondence for whatever purpose in, and IRS has not even opened that mail. So, but they're sending notices regarding the taxpayer's account. So basically the left hand at the IRS is sending notices about information they have in their right hand, but they don't know it. So this is a very frustrating process for the taxpayers. And they expect myself and other practitioners to have a secret access to the IRS or some way to get this information. And that's not possible either. So I wanted to bring that up. So basically, there's a lot of fraud as well. So a lot of taxpayers had fraudulent returns filed, and the IRS has not processed the responses from the taxpayers. Because of that, they're sending out letters to these taxpayers. Their third-round stimulus payments are not getting to them. I think I'm freezing a little, so I'm just giving it a pause. Okay. So I wanted to go through that. I want to go through a couple forms you might see, and the biggest question I get is it legit? So we're going to do that, and then we're going to wrap up with some ideas about the future tax reform that's coming and some things to start to think about. So let me get this ready for you. Okay. So I'm going to start with this notice. This is called a 5071C. When the IRS is attempting to counteract the fraud that's out there, and this notice is being sent to a lot of taxpayers. When I say a lot of taxpayers, at least 30 to 35% of my clients have received this letter. And it goes through, they want to have you verify your identification. So you need to go through this process. So the problem is they're sending out millions of these letters, And you can verify online, but there's a lot of taxpayers that don't want to verify online or can't. They run into a problem. But then you try to call the IRS and they're only answering 7% of their phone calls. So my recommendation is that if you need to call the IRS regarding this notice, to call first thing in the morning at 8 o'clock in the morning. You may get the courtesy disconnect. You just have to keep trying. There is no other way to handle this. The American Institute of CPAs has requested the IRS stop sending letters until they're capable to answer their phone. That doesn't seem to be happening, but this notice, I wanted to just in general say, it's a legit notice. It's really from the IRS, and it's safe to call the numbers on it and to respond so that your refund can be released. The other area is, I just want to quickly go through, the IRS website has a ton of information. They have actually their own status updates about their current level of operations. In here, this is the notice they just issued I was talking about, where they go over where they're at, what number of tax returns they're processing, things you might need to do if you're having a problem. So that is there. You can look at that. You can get updated yourself. As I've said all along, you're your own best advocate to get this information. And I wanted to put it in this presentation so that you can go on YouTube and pause the video and get the website addresses and things like that. The second issue with the IRS is they have said, do not call them to check on the status of your tax return. Because if you mailed it in after March, they haven't even opened it yet. If you mailed it in and they call it special handling, if there's something on your return that's unique, from the date it's open, they are advising 90 to 100 days for them to get back to you. So we're talking into next year almost. So, but if you e-filed and your refund is not known, or you want to check and see if the IRS has opened your mail, they are advising to use the Where's My Refund tool. So that's online with the IRS. You can go through this process so that you can check your status of your refund to see if they've even processed it, if they're in the middle of processing it, or if they've issued a payment. The other area on the IRS website, which is extremely helpful, is this Economic Impact Payment Center. So in here, it goes through, it says, okay, they're sending out their third round payments. But down here, there is all this information on what to do if you didn't get your payment, if your payment was directed maybe to a fraudulent person, if the IRS has adjusted your refund because they say they sent you a payment and you're saying you never got it. And that's one of the more, that's a question that actually Steve had asked me about. So if you're in that situation, what you need to do is you need to initiate a trace with the IRS. I'm obviously going through this very quickly because it's very cumbersome to do these exercises. But again, I wanted to give all the residents of Plymouth an idea of where this information is and how to do it. So if you're saying, I never got the money, I don't know where it went, then you initiate a trace with the IRS. They go through the process of finding out, getting the canceled check. They'll send you a package, find out where it got deposited, things like that. So that's that piece. And then the last area on the IRS website, which is extremely helpful, is the child tax credit update. So people have been receiving advances on child tax credit starting July 1st. I want to make sure everybody knows this is something you may have to repay. If you're a taxpayer that normally owes taxes or is near to break even, these advances are going to not be available on your tax return next year as a credit. So you want to come to this portal to stop that child tax credit advance so that you're not putting yourself in a worse situation when it comes to tax filing next year. The child tax credit was updated to $3,000 and they're going to advance half of that per child. So if you have 2 children, you'll be getting $500 a month or $3,000, but you may have to repay that next year. So this is where you go to manage these payments, to tell them to stop, so that if you, like, for example, if you're a small business owner and you know you owe money, you do not want to be getting these advance credits at all. So those are the resources online. I'm going to take this back as soon as I do that. So that, like I said, that was a lot of information, but I wanted to put it in the video so people can pause the video later when they go on YouTube to look at that. So again, the child tax credit for all the business owners is really going to be the most important thing for you to understand. This is not money, free money. This is an advance on what you're going to have to pay next year, or what you get a credit on your tax return. So to close all this gloom, I guess, a little idea about tax reform. So let's just say we're in the hangover of compliance from COVID, from everything that's happened. This is really difficult to deal with, and it's going to take the IRS literally years to correct items, to move forward, and to get what they have been tasked with up to date and flowing. So tax reform is upon us. There is an issue with what date that tax reform will be made effective. Right now, certain things are written that the capital gains tax rate might be retroactive to at the end of April. That will be challenged constitutionally. It has been challenged in Massachusetts constitutionally before, and the Massachusetts Supreme Court for Massachusetts tax law found that it was unconstitutional to issue a retroactive tax increase, because how can you plan and how can you move forward as a taxpayer? How can you make investment decisions? So that's number one, is that there is this pending issue about what year will it be effective? More than likely, I'm hoping it'll be effective for 2022 for a couple of reasons. That will mean they will not have to go through significant tax software rehauling and rewriting. That's part of the reason why things get delayed. In my opinion, it's part of the reason why the fraud's so prevalent, because things are being done fast, they're not being tested, and there are weaknesses in the software, and fraudsters are taking full advantage of that. So hopefully we can get through without a ton of tax law change effective for 2021. But the biggest issue in areas is going to be the middle class and upper class, the tax reform. Basically, everybody saved about 3% under the Trump tax laws. That's looking to be rolled back. Additionally, you're looking at significant increases for investment income, capital gains income, and estate planning. So nobody knows what the law is going to be. This is the trend, and I really want you to know that if the estate law changes the way the reform has been angling, then the step up in basis for estates would be removed for federal purposes. And this would be a huge tax effect to small business owners that have businesses that they're looking forward for planning to transfer these businesses to heirs and get a step up in basis. Once tax reform is issued, you will want to reevaluate your estate plans under the new law. And those changes can be very significant. So that's basically what's coming. And so we've got a lot of change still, but the IRS does have a lot of tools. Please know that your tax preparer doesn't have a secret access into the IRS to get any more information than you. The IRS just keeps telling us they have to wait. Everybody has to wait for information to be processed. One last thing is that if your tax refund came, because you filed electronically and it came quicker, and your amount has been changed, the IRS will issue a letter explaining that change. But even those letters are coming almost 2 months after the change. Again, there's nothing that can really be done until the IRS corresponds with you. So at the end of the day, everybody has to keep being very patient, use the tools and information to advocate for yourself. And hopefully things will start to clear out as the IRS moves through the biggest part of tax season's mail and can get themselves caught up and accounts fixed for our taxpayers. So that's my update.
Thank you, Heather Cozby, and she's the Plymouth CPA.
Even my light just went off.
And we're going to go right to Mathew Muratore, Plymouth State Representative. Matt, what do you have for us?
Hey, Steve. I'm coming to you actually live from the State House. Only my third time here since March of 2020. But just some quick numbers that Barry didn't cover. In the last week, there have been 3,900 cases of COVID-19 with folks that have been vaccinated. That's down from 500 from last week when we reported that. And also, we're down 50 of those folks that have been hospitalized through breakthrough, down to 61 this past week. And we've unfortunately had 18 more deaths. By next week, we'll probably see 30,000 cases, breakthrough cases of COVID-19 with those folks who are vaccinated. We're actually at almost 28,000 at this point. The 7 day, the cumulative testing is now, we're looking at about 500,000 testing cases a week now in the Commonwealth. Right now, we're at 27,207,000 tests that have been done in the Commonwealth since March of 2020. The 7 day average, though, has gone down slightly since we spoke last week, Steve. It's at 2.28% of those that have testing positive for COVID-19. And if you recall, that was once close to 30% back in 2020, and as low as 0.5% before the Delta variant began as well. So, so at least in the Commonwealth, we're seeing the numbers coming down slightly. Hospitalizations, although are up slightly. We're at 715 folks who are in the hospital due to COVID-19. That's up 100 from last week, but again, far less than the 4,000 that we saw at the height of this back in 2020. Of those, 202 are vaccinated folks that are hospitalized, and that's up slightly from last week. And intensive care numbers have gone down slightly. We're now at 88 folks in the Commonwealth that are on ventilators in intensive care. Then the total number of vaccinated folks in the Commonwealth, 9.3 million, have one dose. And we're looking at about 30 doses of vaccinations a week. So we should be probably, if not next week, the following week, up to 4.6 million folks fully vaccinated here in the Commonwealth. Right now, we have 72% of the Commonwealth that has at least one dose. So we continue to climb on the vaccinations, and that's what we need. We continue to need to try to get people to get vaccinated. So that's the update from the State House, Steve.
We'll be joined by Carolyn Rains from the Plymouth School Department. She's the Director of Health Services. And in view of the time, we're going to move quickly. We have a couple of questions. The first question from viewer Pat, I think, pretty much has been answered by Dr. Potvin, except Dr. Potvin, I'd like you to also provide information as to at what time your next meeting is going to be on Wednesday and how can people access that. But along with that, a similar question from viewer Pat is from viewer Charlie. And his question, would Plymouth, especially Department of Health, Board of Health, consider starting a local media public service effort promoting vaccine in order for our community to reach a much higher percentage of eligible citizens vaccinated? So Dr. Potvin, a very similar question to viewer Pat about public relations and your response.
Yes, Steve. So the Board of Health meeting meets the second and fourth Wednesdays of each month from 4 to 6 p.m. And it is broadcast by PAC TV. It's also available for viewing on Verizon and Comcast. And it's also recorded by PAC TV. In order to access it, if you just send an email into Plymouth-ma.gov, I believe it is, it's public health at Plymouth-ma.gov. It gets read on air during the meeting, and we try to respond to it. So that's how you can access the meetings. In terms of public outreach, we've been trying to figure out how to do public outreach forever. We haven't been able to succeed very well. We do put information out in a number of formats. We were putting it out frequently on Old County Memorial, sometimes on WATD, but it's difficult to do than to figure out exactly how to do it so that the maximum number of people will actually see the information. Thanks, Steve.
Thank you. And we're going to thank each of our panelists today in view of the time. Again, thank you, Dr. Barry Potvin, Chair of the Board of Health, Heather Cozby, who is the CPA, and each week welcoming Plymouth State Representative Mathew Muratore. Please join us next Wednesday at 12 noon as we will continue to monitor the status of the COVID situation here in Plymouth. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us.